who do you recommend sees a chiropractor? How do you know? And then also some tricks and tips for proper stretching, proper posture, these kinds of things. I mean, shoes, whatever we can do to help us so that we don't end up with problems with our spine.
Well, Scott, those are a lot of questions. I think we could be here for 3 hours if I just kept talking about those, but I'll try to be succinct. One of the things that's important is that it's what you're hoping to accomplish with chiropractic care. So, for example, there are athletes like Aaron Rodgers, who I think is a quarterback for the Jets, Tiger Woods, who a great golfer, and Olympic athletes. They all see chiropractors regularly. And what chiropractors do for them is help them to continue to move and perform at peak levels. And that's because they're not only just manipulating their spine, but they're manipulating other joints. Sometimes people do a technique called active release technique, where they're actually working on the tissue and fascia and helping people stretch. So it's really what you're trying to do. If you're an athlete, a weekend warrior, you're someone who likes to pile up the miles doing marathons, you would probably benefit from regular chiropractic care. And then there's people who have chronic disease, degenerative disease, and they may even be getting treatment, pharmaceutical treatment, other medical treatment, and they too may benefit from chiropractic care. In my own practice, I have a wide diversity of patients. I have some patients with frozen shoulder, and I treat them for that. I have patients who have headaches, and I treat them for that. Patients who went through an accident, have a traumatic brain injury, and have balance issues, I treat them for that. The most important thing you need to do when choosing a chiropractor is just vet them, see what they're about, see what they do, make sure that they're tailoring their treatment to you and your condition. But I always think about it like this. If you have back pain, I always go in the order of least invasive first. So if I can do it by rest, relaxation, stretching, hot and cold, then I'm good. And if I need to get help, then I might go to a chiropractor or physical therapist. And if that doesn't help, maybe I'll go to a physiatrist, another medical doctor, and see what I can do and work my way down before just jumping in and getting a cortisol shot or a Medrol dose pack and a bunch of muscle relaxers, when I could have maybe went the natural route first prior to doing all that. And again, even if you do go the medical route first, sometimes just a little bit of maintenance therapy by a chiropractor, physical therapist, is helpful. So that's kind of my short answer of all that. Thank you.
So you gave us, just a little glimpse into the chiropractic, and but how about those of us who are feeling pretty healthy and we aren't trying to treat something? Are there some, just like general lifestyle hygiene stretching that people should be doing who aren't facing an injury or a condition of any kind?
Yeah, absolutely. The more you can move, with free movement where you're not stiff, the less likely you're going to get injury. There was a physician who was an athlete and actually an orthopedist, and he had a number of exercises. And like one of the main ones was if you could touch your toes. And if you couldn't touch your toes, you were more likely than not to be predisposed to having severe back pain. So there's a lot of things you can do with stretching. One of the issues with manipulation of the spine is really all we're gaining is increased range of motion. We're trying to help people to be able to function better. So it's really things like that. I look at chiropractic as both wellness and preventative, and I also look at it as symptomatic. But it just depends on how you're going to add that to your repertoire. To me, one of the best things you can do is hydrotherapy on a regular basis. It's cheap, it's effective. Stretching, it's cheap and it's effective. Those are things you can do on a regular basis. Sunlight, if you live in northern latitude, getting a red light bank in your home, making sure using a sauna, again, if you're in those northern latitudes where it gets really cold, just those regular things. And then of course, diet. To me, diet is foundational. I look at diet and exercise foundational, and then I see chiropractic as one of those interventions that you can do to kind of help. But those two, if you do chiropractic and not those other two, you won't get the results that you really want. And again, hydrotherapy, hands down, I do it all the time. I swim in the cold water. I think the water in an unheated pool here in Florida is probably 55 right now. I'll be swimming in it tomorrow. And that's a great way to reduce inflammation. You got to build your way up. But again, those are simple things to do. And then I look at chiropractic as something you can do to keep yourself well maintained, to keep that active range of motion, to keep you from getting stiff and all that.